Hi, I'm Dr. Paul Ruff at West End Plastic Surgery, and we're here for another Zoom chat. I'm with our cohort, Kelly, Bonnie, Norah, Erica, and we have Christy with us today, so we're so excited. So today we're going to touch on neuromodulator therapy, and that's just kind of a blanket term. You know, most people would just say Botox. It was the first neuromodulator out there. It's kind of like saying Kleenex, and really talking about tissues. It definitely has the highest brand recognition, but there are others out there. There's Dysport and Xeomin, and there's Jeuveau, and there's even Ruff, because another one coming out that is theoretically longer lasting. I've seen the studies, but haven't utilized it quite yet. But it really sparked a lot of the expansion or explosion of interest and acceptability of cosmetic and plastic surgery over the last 20 years. I mean, it's been around for quite some time. Everybody thinks botulism and gets a little bit anxious about that, but it's really just a protein that targets a portion on the muscle that breaks the signal that creates muscle movement. And it's extremely targeted. It's very precise. I think it is probably one of the most reliable things we do in all of medicine. Safety is high. I oftentimes say it's safer than having a bottle of Tylenol in your medicine cabinet, which can cause liver damage. And when used properly, it is extremely effective from a rejuvenative standpoint. So it's probably one of our favorite therapies that we use, oftentimes in conjunction with fillers and other things. And which one we use for a different person, definitely that varies. People do respond slightly differently to different neuromodulators. So just to start off from a discussion standpoint, where do you all like to use neuromodulators in your aesthetic framework?
So for me personally, I love neuromodulators and I love injecting them. It's fun for me. I would say the most historically and even now the most common areas that I inject Botox are the frown lines or these glabella lines.
Those lines.
Yeah. Where I have some partially kicked in, so I'm trying to make movements. Forehead lines, horizontal forehead lines, crow's feet lines around the eyes. Those are probably the three most common areas. However, Botox can be used in a plethora of other areas on the face. We can do a little bit underneath to give a little bit of a brow lift, underneath the eye to help soften some of those lines. Bunny lines, so bunny rabbits make this face, makes these little lines, so it can help soften and smooth those lines. It can help for some people when they smile up and show a lot of gum on their smile. We can do a little Botox. Yeah, to help with that. Another popular one is lip flip to give a little bit more aversion to the lips and a little bit more lip show. Another area can be used with people who make this frowning movement a lot. We can relax and release it up so it gives their corners of the mouth a little bit more of a neutral position. That's a good face. I just want to shoot some in there, Dr. Ruff. Another area we can do it is kind of poda orange or pebbly chin. Kind of this cobblestone look on the chin. Some people have a really active mentalis muscle and they make that movement all the time. It could be distracting when they're giving speeches or that type of thing. So doing a little bit of relaxing there. Dr. Ruff and I had talked recently, and Norah as well, as one of the other most common areas that we're finding to be more and more common is in the masseter muscle, or this large muscle that sits right back here. A lot of people, especially in Washington, D.C., with stress, we're kind of grinding or making that movement. This muscle gets bigger and kind of widens out the face a little bit. So softening and relaxing those muscles can also help with a little bit of jaw discomfort in that area. Moving down the platysmal band, some people, if you're talking to them, they make this distracting face. I just want to shoot them with Botox right in those areas so they don't make those pulling movements as much. And then Botox can also be used as we're heading into spring and summer for hyperhidrosis or excessive sweating under the arms to get rid of that smell. So that's another common area. As Dr. Ruff talked about it, the Botox will relax the signal from making you make that muscular movement. With the underarms, it relaxes or it blocks the signal of telling your body to sweat in that area. And then I'd say another up and coming popular area is calf slimming with the Botox. So those are kind of primary areas, and then some of the more fun areas that I use it in my practice.
Yeah, I think that's a really good review, and it can be highly effective. So, like Norah, when a patient comes in and just says, I really want to feel better, I'm not sure where I want to go, like, how do you go through an assessment based on, or how do you go through an assessment to help them understand where this may or may not fit in? I mean, I think it's probably one of the most common things we do, and it's probably what people tend to steer towards. But when you're actually sitting with somebody right in front of you, like, what are the things that you're looking for in helping patients understand when talking about implementing something like this?
Well, when it's a first-time patient coming in, I go through, the education about, the product, what to expect, or actually also, what are they looking to achieve?
Yeah.
Do they want a frozen look? Do they want to have some movement? And to let them know that, you can achieve natural, subtle results, with neuromodulators. And, some people, the question I get all the time is, do I need Botox? Well, my answer is nobody needs Botox. However, if you're asking me if I think it could help, enhance or relax some of the wrinkles and fine lines and give you an overall refreshed appearance, a little bit less tired, maybe, as Christy talked about, even help soften a frown line, then absolutely. And, it ranges. Everyone's treatments, their regime is different, depending on their goals and their budget and what they want to achieve. So some patients come in twice a year. Most of my patients come every 3 months, but there are some that come, 3 times a year. And, I listen to, what they want, address their fears and misconceptions, and, that it is a safe, effective treatment and something that they usually will try.
And at what point would you say someone should start getting Botox? Like, I'm 26 and I've been hearing some things about it's preventative, and if you start at a younger age, you won't look as old when you are getting old. So what's your take on that?
Well, everybody talks about this concept of prejuvenation, and my patients tend to skew just a little bit on the older side. I've been doing a little bit longer than anybody else here. So we're really in the more treatment-based, but this whole concept of prejuvenation, I can tell you, and we've had this discussion in a couple other chats that we've done. Like, I have patients that I started doing almost 20 years ago, essentially 20 years ago, who have now been through 20 years of neuromodulator therapy with me, and I can tell you for sure that their faces are definitely less strained. They don't have those etched-in lines that counterparts who start much later in life see, because they don't, I liken it to a piece of paper. You start taking a piece of paper and you just kind of go like this for a long time, you're not going to see any line, any crease, any dent in that paper. But if you keep doing that over time, you start to weaken those little fibers. Same thing happens in our collagen. Now we start to weaken those little collagen fibers, and our repair mechanisms can't keep up with that. And that's when we start to see those lines let set in. And there was a great recent study that looked at people who lost function on the side of their neck from their muscle, that, the platysma muscle that does this. And they looked at the side that was paralyzed versus the side that had normal activity. And the side that was paralyzed was far younger looking than the side that was normally active. So that mechanical stress on the skin surface does have an impact over time. So when do patients start doing it? When they feel like they can, when they can afford it. And it doesn't have to even be big doses early on. So a lot of times, I think you all would agree with me that small doses, younger, 2-3 times a year, definitely helps keep that skin less stressed over time. What do you all think about the time frame for starting?
Go ahead.
I often tell patients, expression lines turn to fine lines, turn to wrinkles. So if you're seeing those expression lines start to form, that's a really good time to start to think about it.
Yeah. So I would agree with Bonnie. I've done patients as young as 18. I remember she came in with her dad, deep forehead lines. If you just look at your forehead, you'd think it was a much older individual. Her dad had the same thing. So a lot of it's genetics. It's how you move your face. Some people just don't make certain expressions. So I tell people, look at the areas where you would make expressions. If you see any fine lines starting to form, kind of that the initial folding that paper analogy, then it would be time to do the Botox. And some people, that's as young as 18. I had a coworker, she was 67, completely smooth forehead, never had Botox. She just doesn't make that line or movement. So that's kind of what I tell people to look out for. I do get the question a lot of baby Botox and what is baby Botox? We're not injecting babies. So I get that a lot. We're not injecting babies. We're not harming babies, but we do want your face to still look like a baby or baby face. So that's that idea or concept of people typically in their 20s to mid 20s, seeing some of those fine lines, like Bonnie was talking about, starting to form and starting out with kind of lower dosing. So they're still having movement. All of our treatments are customized to the patient's face. So we're looking at the bulk of their muscle, how strong their muscles are, and kind of picking our dosing from there. And the nice thing about Botox is you can always add more. So we do have people come back and we add a little bit more to kind of soften those lines further. It's always easier to kind of keep increasing that or adding more than it is to take away.
Yeah, I think it's highly customizable. I mean, that's one of the nice things about it. We can adjust to full paralysis, which I think is so 2000s. When we started doing this, everybody's like, just freeze it all.
People get scared of it, they get
and that is true.
Yeah.
Yeah, that is 100% true. But we can really adjust the amount of movement people want to see. Adjust our dosing, adjust our dilution sometimes a little bit, just to get certain amounts of spread versus focusing. People practitioners who do this well, who really train, who are observant, I think are exceptionally talented and creative, even being able to adjust minor movement-based asymmetries that can look like volume asymmetries in some ways. For most people, this is in and out. I mean, almost no residual issues. I mean, there's always a chance of a bruise. There's always a chance of asymmetry. But I mean, from a safety and efficacy standpoint, or acceptability standpoint, oh my goodness, probably one of the best.
Yeah, good lunchtime treatment.
Good anytime treatment.
From an aesthetics point of view, we're asked by our patients often about these really expensive serums, really expensive creams. And while all of those are good for the surface of the skin, the texture of our skin, we reach an age where you need a little bit more. You need something to actually help the formation of the line. And so a lot of times when asked about a very expensive product, I'll let a patient know the creams, serums, all of those products are great, but you just need a little bit more.
I've also found, and I don't know if any of you guys have found this, but the older age group, anybody kind of 35 and above, still kind of see it as a little taboo to share. And so they think like, I'm not ready yet. I haven't set those lines in. Where the younger generation is really game for that baby Botox, or really game for the preventative Botox. And it's kind of transitioning some of our middle age, our 35 and above, to recognize it's okay to start. It's okay. It's not a negative thing. It's not a taboo thing. It's not something that we hide anymore. So it's becoming.
Oh, I'm sorry.
What was that?
Well, and it's also very popular with men. So I've had the Brotox texts, asking when are we going to be injecting again, because it's both for men and women.
Yeah. Men want to look good too.
Absolutely, I think that's good. So I think it's probably one of the, like I said, it's been about one of the foundations of this explosion in interest in aesthetic procedures, cosmetic surgery. Those who really, like I said, study, observe, understand the anatomy. We have the ability to inject not only areas of the face, but in the underarms and other regions to be able to give our patients truly customized and bespoke experiences with respect to all of this. And it is a good foundation from a rejuvenative standpoint. So this is Dr. Paul Ruff with my entire team here. Bonnie, Kelly, Norah, Christy, and Erica from West End Plastic Surgery. Don't forget to follow us on our different social media channels. If you're interested in anything like this, you can go in through the website at www.westendplasticsurgery.com. Email us at info@westendplasticsurgery.com. or call us 202-785-4187. We look forward to seeing you again in another Zoom chat in the near future, and hopefully back in the office soon. Take care, and thank you so much.